Hey everybody, welcome back to ClinicalTrials.gov. Again, that website address is ClinicalTrials.gov. I've been so busy right now. For those of you watching it from the future, it's September, right around the middle of September 2013, and I am just extremely busy at all my research clinics. But I'm still answering emails, and today's email comes from a viewer who just recently purchased my How to Get More Studies DVD. So shameless plug, it is $69.99. It is a fantastic way for you to learn how to get more studies from your clinic. And in the DVD, I talk a lot about using ClinicalTrials.gov, how to use it well. I do screenshots where I show you how to use it. I've done videos on that for free as well on my blog. So in this video, I will not use a screenshot, but I want to clarify something. When you use ClinicalTrials.gov to find studies, to look for studies that your research site might participate in, you want to check the ones that are recruiting or not yet recruiting. And what they mean by recruiting is they're not talking about recruiting sites, okay? ClinicalTrials.gov is meant for consumers, it's meant for patients. So when they're talking about recruiting or not yet recruiting or active but not recruiting, what they're talking about is recruiting study participants, recruiting people to get into the studies. But you, as a research clinic, should use that information to your advantage. For example, if you see a study for asthma that is recruiting, you know that that study, especially if it's been there for a long time, um, hasn't met their enrollment goal yet. There's also a good chance that that study may not be doing well in their recruitment efforts based on how long the study has been going on. And you can tell many different ways, but look at the projected enrollment end date. And let's say the projected enrollment end date for the study was August 2012, and we are now in September of 2013, and they are still recruiting subjects. You know that they are way off their projections. Recruitment's probably not going as planned, and you, as a research clinic, as a site director, as a business development director, whatever it is you may be, you have an opportunity here to reach out to that sponsor and say, hey, I have a clinic here. We feel we can do a good job. We may not enroll hundreds of people, but we can enroll 15 and 20 solid study participants and help you out in your recruitment efforts. And I talk a lot about that in the DVD, How to Get More Studies for Clinical Research Sites. And don't be afraid about being an add-on site. There's many advantages to being an add-on site, and I'll do a video on that later on. Actually, I'm going to write that down because it's a great idea. The advantages of being an add-on site. Uh, but anyways, I just wanted to clarify that being an add-on site. So when I do these videos, I have no script. I just kind of shoot from the hip, and when I get good ideas, sometimes it's in the middle of an actual recording, and I won't edit it. So keep me honest. I'm going to do a video on the benefits of being an add-on site, because there are many. There are many. But anyways, as far as getting studies using ClinicalTrials.gov, it's one of many ways that I talk about on my DVD, How to Get More Studies for Your Clinical Research Site. Definitely use ClinicalTrials.gov to your advantage. And when you see recruiting or not yet recruiting, those are studies that you can possibly target, because those are studies where the sponsor has not met their enrollment goal. Sometimes they haven't even started recruiting, so you can get in at the very early stages. But anyways, hopefully this helps. I'm going on too long now, but I even got a good idea for a future video. Thanks for watching. This is Dan from ClinicalTrials.gov. Subscribe on YouTube. Subscribe to the blog. Drop comments. Get the DVDs. And shout out to my Clinical Trial Guru producers, Sarah Elizabeth Siegler, Resolve Research Solutions, Accurate Clinical Trials, Erdhart Clinical Trials, PTNR, Patrick Stone, Darshan Kulkarni, Biopharm Systems, Zymewire, Mozio, South Coast Clinical Trials, Breakthrough Clinical Trials, and St. Paul Medical Research Center in Miami, Florida. Thank you all very much, and stay tuned for future videos, and keep me honest with those. Alright, I'll do videos in the future, and keep sending your questions. Dan at theclinicaltrialsguru.com. Thanks for watching.